Welcome to the webinar. We're excited to have you here today. I'm going to start off by introducing myself. My name is Dr. Lewis Wolfel, and I am the founder of NextGen Medicine. I will be your presenter today, and I have spent the last 17 years of my life dedicated to finding the most natural, advanced, and cutting-edge treatments to help people who are suffering from pain. And today, I am excited to share with you information that can change your life. Imagine a life without pain, while your doctor won't tell you about medical advances that will eliminate your pain. We're going to discuss our purpose. Our purpose is to give you information to help you get out of pain quickly. We want to show how to regain and revitalize your health. And we want to maximize your health potential for the rest of your lives. We have some goals today. We want to discuss the options that are typically used for pain. We also want to discuss the options that are new and upcoming in medicine. And we want to determine which option and solution is best for you. Lastly, give you enough information to allow you to make the best decision to do something about your own health and give you an opportunity to do so. Who are we? Well, NextGen Medicine is a network of doctors and other health and fitness professionals that were brought together to provide advanced, cutting-edge procedures combined with traditional medical and alternative treatments to allow patients to have access to more options when making decisions for their health. Our network consists of physicians, physical therapists, chiropractors, acupuncturists, massage therapists, and personal trainers. Having a team of multiple specialty allows you, the patient, to have access to the most comprehensive healthcare possible. Alone we can do so little, together we can do so much. That's a quote by Helen Keller. It is important to understand your options. People just want to know what these are. These are common treatments given by your doctor. So let me ask you something. What's the first thing that your doctor gives you when you go in to the office for pain? That's right. Some type of pill, prescription medication. Many of you have heard of Flexeril, Norco, Vicodin, Motrin. And then how about that doesn't go away? Have you ever heard, hey, if this, from the doctor, if it doesn't go away in 30 days, why don't you come back and we'll see what happens then? That's very common. So then you come back in 30 days and your doctor says, well, you're still having that pain. Let's try something else. How about physical therapy, chiropractic, acupuncture, massage? Now, you get a lot of great results with these things, and they're beneficial. But if you have a more complicated case, you may still have the pain. So then you go back to your doctor and you say, well, what can I do next, doc? Well, let's do cortisone. And many people don't want to do cortisone, but that's an anti-inflammatory. It helps some people, but at times it comes back. So then you still have the pain, and you say, doctor, I still have this pain. What can I do now? Well, let's try something for viscosupplementation. Well, viscosupplementation is just for the knee. So if you're talking about knee pain, many of you have heard about this. So after cortisone, you may have done this. This is a lubrication for the knee. It's like WD-40 is what I like to say. So you have Synvis, hyaluronic acid, Suparts. These last about 8 months, 6 to 8 months usually, sometimes a year. But then if that doesn't go away, then what do they recommend? Some type of pain injection. Many of you have heard of epidurals or nerve blocks, like, for example, in your neck or your low back. Well, many of you don't want to do those, but if you do, and then they feel better for, temporarily for a little bit, for a couple months, and then you still have the pain. So then you go back to your doctor and you say, we've done all of these above, we've exhausted everything, what can I do? He says, well, you can either live with it or you can have surgery. And many people don't want to do surgery. This is what I hear a lot. I don't want surgery, so there has to be another option. Well, about 8 years ago, I decided that my practice needed to find another option to medications and surgery. So we started surveying our patients, and the questions they all had came to these simple things. What other options do I have to get me off pain medications, and what can I try before having a surgery that is irreversible and permanent? Well, we did our homework. My medical team and I did our research to find more conservative, less invasive, and more natural solutions. And we found it. So if you or a loved one has been diagnosed with a bone, joint, ligament, tendon, muscle, or nerve problem, today's information could change your life. We're going to introduce you to a new field in healthcare called regenerative medicine. Regenerative means, by definition, to bring into existence again. With regenerative medicine procedures, you would not only eliminate your pain, but repair, rebuild, and heal any injured area of the body. For example, If a lizard loses part of its tail, the tail grows back. That is what we mean by regeneration. Now, as humans, we are not there yet in this field, but I say yet. So it is important to remember that there's a lot of expansion and research in this field, and there's many things that we could do, but right now we're talking about regenerating tissue inside the body, such as a joint. We're not discussing how to feel better. We are discussing how to have your injured area actually regenerate. Our goal is to help you have as much regeneration as possible. Like I said, a lot of research has been done. Research is being conducted at leading universities and hospitals, such as the Mayo Clinic, Harvard, and Stanford, all of those types of universities and researchers that are well known.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures.
Okay, regenerative medicine offers a way to eliminate degenerative disease related to pain. Degenerative means to become worse over time. Degenerative diseases are those health problems that will get worse without proper treatment. These include arthritis and most muscle, tendon, cartilage, nerve, and joint problems. So let's talk about arthritis. This is a normal knee. As you can see, the joint space in between is thick. You have thick joint space, you have cartilage is healthy, you have the alignment is normal, and there's no signs of degeneration. Now, if you look at phase 1 of arthritis, you have the cartilage softens, the cartilage loses its ability to absorb impact and is more easily damaged, and there's joint space loss. You can see that in the inside here on your right hand of your screen and on this x-ray. You can see how it's different from the first one. Now, phase 2 of degeneration, you have large sections of cartilage that may wear away completely with time. And the joint begins to lose its normal shape, as you can see from the previous one, as the cartilage breaks down. This is important to know. This is usually where most doctors say you have arthritis. They usually skip the first one, unfortunately. But when they can see these signs, that's when they say they have arthritis. But I want you to know these phases. It's very important. Phase 3 is what commonly is known as bone on bone. Bony growths or spurs called osteophytes may form on the edges of bones and joints. Open cysts may form in the bone near the joint, and bits of bone or cartilage may float around in the joint space. So what phase are you? That's what I would like to know. Most people come to the office say I have arthritis, and they don't even know what phase they're in. So they may be bone on bone. Some people say they've been told they're bone on bone, and they're not. So it's very important to know what phase you're in so you can know what treatment is best for you. Drugs could reduce your pain, but do not stop the degeneration. As a result, people take drugs for pain may continue injure themselves even if they do not feel it. You will feel better today, but actually be worse tomorrow. In fact, non-steroidal anti-inflammatory drugs like Tylenol, Advil, Aleve, etc. may make you feel less pain, but over time, they destroy cartilage. Opioid drugs like oxycodone and phenol may reduce pain, but are addictive. Opioid drugs now kill nearly 1,000 people each week, more than those killed by auto accidents. According to AARP, 1/3 of seniors have been prescribed a form of these addictive drugs. Tell me the truth. If your car had an oil or check engine light go on, would you put a piece of tape over that light and just pretend you didn't see it? Many people are taking care of their cars better than their body, because most of you would not do that. You would go to the mechanic, right? Exactly. So let's take a look what we can do for your body, because of course not. You're not gonna do that with your car. So take care of your body. That would be like taking a drug for a problem. You don't feel it, but it's still there. Cortisone shots or pills are often prescribed, as we mentioned before. Studies have shown when taken for 4 months, cortisone could cause an 8% loss of bone. That's 8% loss of your bone by just taking cortisone. Taken for 1 year, research shows cortisone could cause cataracts and elevated blood sugar. When drugs fail, the only alternative up until now has been surgery. All surgeries can have complications. Today, we're going to provide you a solution to degeneration pain-related problems that is safe and effective. You have 2 choices with any problem in life. Number 1, you could keep doing the same thing over and over again with the same result, which is the definition of insanity. 2, you could try something new and resolve your problem. If we can show you today a way to get rid of your problem naturally and affordably, would you actually do it? Okay, let's now look at solutions to problems that you have. Regenerative medicine and stem cells. It's the hottest medical topic of the decade. Stem cells regenerate. Stem cells are known as the body's master cells because they are able to develop into all other cells. They actually become new cells. For the purpose of our webinar, we are discussing pain and orthopedic conditions. Stem cells have the ability to become new cartilage, ligaments, bone, muscle, and nerve tissue. For regeneration to occur, the body needs cells that have the ability to rebuild the injured area. In the body, these are called mesenchymal stem cells, MSCs. Perhaps a better name for the MSC cells would be messenger stem cells because they transmit a message to all the cells in your body to come and help restore and regenerate an injured area. The MSC, messenger, or mesenchymal stem cells bring an army of healthy cells to the area of need. Altogether, this powerful team of cells that heal you is called the matrix. The matrix helps your body with reduction or elimination of pain, reducing inflammation, minimizing scar tissue, promoting soft tissue growth, and generating new bone, cartilage, muscle, ligament, or nerve tissue. It's the elements of the matrix along with the MSC that help your body repair and fix itself. Stem cells are migratory. This means they will migrate to or move to the area that is most in pain or injured. The problem is, as you get older, the number of MSCs could drop to 1 out of 400,000. Therefore, it will become more difficult to heal as you get older. So look at this chart here. When you're born, for every cell, 1 in 10,000 for a newborn is a stem cell. Why? Because that baby needs to grow into an adult, correct? Well, as you get older, you can see along this scale here, along this graph, that when you get to age 50, it's 1 in 4,000. And when you get closer to the 80, 1 in 2 million. Why is that important to know? Because there's different treatments for different people. All right, we're going to go over that. So if you have less cells in your body, less stem cells, then you're not going to heal. You're going to age and you're not going to heal as quickly because you don't have as many stem cells. Regenerative medical procedures can bring your body hundreds of thousands or thousands, if not millions, of MSCs and matrix cells to help your body heal naturally. So the choice is to either take drugs to reduce symptoms, do surgery if possible with all its side effects, or receive regenerative medical procedures and stop or eliminate the degeneration while also rebuilding and make new tissue in the area of need. There are different treatment options based on what would help you. So this is why I want to go into this, because many people are very confused about the different types of stem cell treatments and what's best for them. Well, adult stem cells, also known as mature stem cells, come from your bone marrow or adipose fat tissue. So most people say, well, I want to get them from my own. Well, this is the problem with that. If you're older, and as you see in that graph, you saw in that graph before, when you're older and you have less stem cells, it takes more treatments if this even works for you. So depending on your age and your health, you need to understand this may not be the best option. But adipose tissue, about 2 years ago, was the FDA actually said that they prefer not to have this done because it can be manipulated. So if someone's still doing the adipose, it's usually against the FDA regulations, or they look down upon that. Okay, so this also can have risk of infection and residual pain from the donor site. So that's usually the common side effect of this, because it is a very invasive procedure. You can see that needle; it doesn't feel good. The next thing is an embryonic source we could get stem cells from. However, that is illegal in the United States. We do not take them from fetal tissue or any type of baby parts, and that's what people are very concerned about. So that is illegal in the United States. That is not acceptable, and that we can't do that based on the regulations of the laws. Now the next one, which is the closest to what we could do to fetal tissue, which is not as good as actually umbilical cord, because it's an immature stem cell. But what I want you to understand about umbilical cord tissue, these are actually adult stem cells, because it is in the mother, but it's coming from taken from donors who are concerned with the welfare of others. These are healthy mothers that are pre-screened when chosen, have scheduled C-sections. Certified harvest technicians transport the tissue immediately to the United States, certified FDA-approved tissue laboratory, and then the tissue goes through rigorous testing and process within 48 hours to produce a high-quality product that is safe and effective to be given to the public. The other types of regenerative medicine products, we have platelet-rich plasma, or PRP. Many people have heard about this. If you watch sports, a lot of athletes get this done. So this has growth factors and recruits the body's own stem cells to the area. Best results with phase 1 to lower phase 2 degenerations and tendinitis and muscle tears. So what happens is they draw your own blood, then it gets centrifuged or spun in a centrifuge, and then it separates from the red blood cells and the plasma. They extract the plasma, the top layer, and they inject into an area of pain, such as a knee or the neck or shoulder. All right. So once again, just the takeaway from this is it has growth factor. It is not stem cell therapy, meaning that it's not direct stem cells like the bone marrow or umbilical cord. People get this confused. They're told that I'm getting stem cell therapy, but it's actually PRP. What stem cell is regenerative medicine, and what it does is recruits your body's own stem cells to the area. Now, another type of product is AmnioFix. What is AmnioFix? Well, AmnioFix is a bioactive tissue matrix allograft composed of dehydrated human amniochorion membrane that preserves and contains multiple extracellular matrix proteins, growth factors, cytokines, and other specialty proteins which are natural. So in English, well, it's dehydrated tissue from around the amniotic sac and the membrane that surrounds that. It has a high concentration of proteins, growth factors. Cytokines are actually what are like the foremen of the body. They tell everything what to do. Okay, and there's a lot of what it does is, because of these growth factors and the interactions, what happens when you inject this into the area with all these proteins and growth factors, it recruits your body's own stem cells to the area. So depending on your condition, depending on your age, this may be the best for you. I like to say it's like PRP on steroids. All right, the key benefits: recruits your own stem cells to the area, reduces scar tissue formation, modulates inflammation, and enhances healing. Which option is best for me? That's what everyone always wants to ask. Well, depending on the severity and your type of problem will determine which treatment and product is best for you. How many treatments do I need? Well, bone marrow averages 3 to 5. Now, that invasive procedure, it does average 3 to 5. Once again, because if you're older, you're going to need more procedures to get enough stem cells to actually be effective. Umbilical cord tissue, the average is actually just 1, because it's immature cells, because they're so immature that they have, we know how many are actually going to be injected as well. It could be millions that are getting in the procedure, so it averages just 1. AmnioFix is average just 1 to 2, and that depends on another your your age and different factors as well. PRP averages about 3 when you're using your own blood. How fast does it work? Well, it depends on many factors such as your age, level, degeneration, genetics, and overall health. Most people feel relief immediately. Regeneration continues for 6 to 9 months after the treatment. That's important to remember as well. Some people, if you're bone on bone, it's going to take a little bit longer, but it still continues to regenerate 6 to 9 months after your first initial treatment. How long does it last? Well, if your body responds well to regenerative medicine, then it regenerates new tissue. That new tissue is permanent and it will last forever until you damage it again. If your problem is more complicated, for example, bone on bone, it may give you relief for 1 to 3 years. That's where you have to make. Is it better than surgery? Well, what is the success rate? We can only speak for what we have experienced in our clinics, and each patient's results will vary due to the severity of the problem, age, weight, diet, genetics, overall health, and other complicating or contributing factors. We have experienced as high as 85% success in joint problems and slightly less in spinal problems. Surgery is 50-50, and once done, it is permanent. Patients report that this is the most common sense approach to a last attempt before surgery, and the chances of success and benefits outweigh any risk, which are very low. It's your choice. It always is. So the next question we are asked is, what does it cost and does insurance cover it? Unfortunately, insurance does not cover stem cell related therapy, but it does cover examination and testing. Also remember, there are other treatments covered by insurance that you may not have tried yet. Okay, so it's very important to remember that. For regenerative medicine, however, the costs vary, but we never let money be a barrier to you getting some form of help. Regenerative medicine's average cost in Los Angeles is approximately $500 for PRP and up to $8,000 for more invasive treatments like a bone marrow procedure. Most people do not require the more expensive treatment, but it depends on your condition. Can cells from another person's body be injected into mine, or is there some process to match them? Well, there is no need to match cells to your body if the option that is chosen is from foreign stem cells such as umbilical cord tissue. The process, when they process these umbilical cord tissues, removes any blood from the product, which would be one of the main reasons that would cause a reaction if present. Additionally, due to high plasticity, there is a decreased risk of graft versus host disease. All these and other questions you have will be answered after we evaluate your specific problem. Only when we know the extent of your problem and the causes will we be able to determine if we can help you and what would be involved. We would then work together to provide a program that would fit within your budget. Look at what regenerative medicine could do for you in 8 months. This is a before and after. Look at the left. This is before. This is how it's degenerated. Okay, of phase 2 to go towards phase 3 of degeneration to a more normal. It's pretty amazing. Now, everybody will obviously differ, all right, and vary, but this was amazing results, and we see this a lot. We told you about 85%. Now, I want to go over the secrets that we mentioned when you signed up. Secret number 1, why your doctor won't tell you the truth about regenerative medicine therapies. Well, the truth is that many doctors are so busy helping patients with so many different types of diseases that they don't have the time to learn about regenerative medicine. So they either refer out to a specialist or tell patients not to do it because they are not sure about what to say. Secret number 2 is regenerative medicine works best when the patient follows a good diet, combine other therapies after procedures while regeneration is taking place, such as in our office and in the network that we have. We do PMF therapy, which is a whole nother topic, but that's pulse electromagnetic field therapy. It helps regenerate and rejuvenate the cells. It works very well with stem cell therapy or regenerative medicine. We also have cold lasers and other types of rehab. There's many different things that we add that other places are not doing, but it's very important that you have these other therapies to help you during that regeneration process. You have to have patience and be positive. Comply with the doctor's home care recommendations. All these will get you well quicker and get the best possible. The last thing is secret number 3, how to pay less for the best quality treatment. Well, NextGen Medicine has a network of health and fitness professionals that have agreed to provide Beverly Hills level of service at Walmart prices. I would like to now end by offering each of you the most precious gift I can. It's the chance to have a longer, happier, and healthier life as is illustrated in this video.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
That is a very powerful video. I'll talk about my story. So the picture, that's when I was a child, and that's my father there. But first of all, I personally have had regenerative medicine performed on my own knee that was arthritic due to an old ACL and meniscus injury. So I had that surgery. Before doing the procedure, my knee would swell up and lock up at times if I was active. I am now able to run, be active, enjoy full life with my wife that I was not able to do so before doing regenerative medicine. So I'm really happy about that. However, the main reason I am passionate to help others with regenerative medicine is that the video that you just saw and watched reminds me of my father. I lost my father 14 years ago to a pulmonary disease. And this video reminds me of the last of his days. I mean, that's what I remember. He was on oxygen. It was the hardest thing I ever gone through. You can all think of someone you have known and loved that suffered and passed away. My purpose is to help people add years to their lives, quality of life, and resolve or reduce pain and suffering. Through regenerative medicine, we can now accomplish that. And truly, it's something that you need to do for yourself because you should not have to go through pain and suffering. As a gift for attending today's webinar, we are offering you the opportunity to receive a comprehensive consultation, evaluation, and recommendations for only $20. You must live in the Los Angeles South Bay area. If you want to drive further in California, you can, but it's we're just trying to figure out how to get people that are more convenient. It's more convenient for them and nearby to help them. If you do not live near us, that is totally fine. Please email info@nextgenmedicine.com for us to find a clinic in your area. I do have a big network, and we can try to find some physicians in the area that can help you. This is an amazing offer and value. The time we spend with you normally costs $300 to $500. Our purpose is to help as many people as possible, so we want you to make it affordable so you can get the help that you need. If you have any x-rays or MRI reports, please bring them with you. If not, we will discuss at your appointment if we need to get any. To receive this gift, the only thing we ask is for you to schedule your appointment by clicking the link today and come within the next week, since we only have a limited amount of slots for this webinar at the special offer. Our purpose is to help you live a happier, pain-free life so you can do those things you could before you had your problem. Remember, problems get worse over time. Unless you try something new, your problem will not go away on its own. You have nothing to lose because we will not waste your time or money. If we cannot help you, we will refer you to someone who can. All we ask is for you to give us a chance to help you enjoy your life to its fullest. Please click the link to schedule your appointment and take advantage of this special offer. It could change your life. We also have a no-risk guarantee. If you come in for your appointment and during your consultation you feel it is not worth your time, simply let us know right before we end it, before we go through the whole thing. We will stop it short and not charge you the $20. That's fair, isn't it? Because we want to make sure that you get the information. But we are confident that you're going to get the information about what you need for your health. Thank you very much, everyone. I look forward to meeting you in person. If there's any questions, you can email me, but go ahead and click that link and we'll see you soon.